All right, good afternoon, everybody. Here with Paul and Josh, and Miguel is here, our Commissioner of Education, in case you have any questions regarding our K through 12 education reopening plan, which was formally released today. Let me just do the daily summary in a nutshell. A couple of things I think that are interesting here. First of all, you'll see that the number hospitalized is now down below 100, COVID-related hospitalizations. That's the lowest we've been in months. You'll see tests performed, a total of 442,000. Because some people are tested twice, that means we're one of the few states that has now tested over 10% of our population. And the positive cases, 59. Yet again, our positivity is down. It's down under 1% for today, and I think it's under 1.2% over the last 5 or 6 days. So these are all numbers we can be proud of, especially when you see what's going on around the rest of the country. The next slide, I think, is one you've seen before. It just goes to show that the total hospitalizations are going down. And as I've implied before, you look around the rest of the country, there are 4 states where the numbers are going up. There are 4 states where over half of all the new infections in the country are in Florida and Texas and Arizona and California. And there are a lot of reasons for that, one of which may have been how they did their reopening. The red lines here you see on our total hospitalization slide is indicative because they tell you from the peak back on April 22nd, our total hospitalizations gone down. Since we first started our major reopening on May 20th, our numbers continue to go down. That's because we reopened carefully. We only reopened when our metrics are headed in the right direction. The next slide is just a way to tell you a couple things. One, I told you our hospitalizations are now down at 99, under 100, but that is now the number is so low, you can't count on that number continuing to go down. You can see that the number of people being hospitalized, the admissions line, that in yellow, we get this out every couple of weeks, has been going down, but more or less flattish over the last couple of weeks. Most of our improvement in terms of net hospitalizations, because the number of discharges has gone from 80 or 90 back on May 30th down to whatever that is, 20 or so right now. And that number is continuing to go less as we have fewer and fewer people hospitalized. One of the things we had confidence in was really important for our whole reopening was to make sure we had plenty of capacity in our hospitals in case there was another surge, the likes of which we're seeing in a number of those southern states right now. And right now, we do have plenty of capacity. I think our ICUs, our intensive care units, are maybe 50, 60% occupied, so we have plenty of good capacity there. One of the things we've thought about is, as you look at those highly infected states where the hospitalizations are going up, not just the positivity rate, what's going on there? Because we thought these were younger people, and because they're younger people, they're much less likely to be hospitalized. But we had our meeting with Vice President Pence today and the rest of the COVID task force, and it did point out because so many more young people are testing positive, we now have a bigger cohort of them who are obese, diabetes, have pre-existing conditions. So now you even have some younger people going into the hospital. So don't stay on your guard when it comes to this. And by the way, now the number of seniors in these other states is being hospitalized is going up as well. I tell you all this because I'm paid to worry. I also tell you this because I said early on in this pandemic, you hope for the best, but we plan for the worst. And we look what's going on in particular those 4 southern states. But as they said in the Pence task force today, remember, Ohio is ramping up, Wisconsin, parts of Wisconsin are ramping up. So it's not simply related to just those southern states. What went on in those big 4 southern states? Why at risk? 1, perhaps they opened a little early. 2, they are beginning to close down now. You'll see that Texas has said, You know, one, they're going to close down all the bars that have been open for a month. Well, as you know, Connecticut never opened up its bars. Sorry about that, but I think it was a good move. Two, they're reducing their restaurant capacity back down to 50%. Ours is at 50% right now, and strongly recommend if you can get an outdoor seating, that's where you want to be. I was interested that for the first time, Texas said in any municipality that requires it, you must wear a mask when you're inside. This is something that Connecticut has done from the beginning, made sure that if you can't socially distance and you're not outside, you must wear that mask. And so I'd like to think that a lot of these other states are coming to where we've settled on, which has kept our positivity rate much lower than it is in other parts of the country. And again, a special shout out to our neighbors, our neighboring states who have also been maintaining what they got to do. And I do get anxious because there's a very narrow margin for error. And when I hear the governor of Arizona say in just 2 weeks, our positivity rate went from 4% to 14%. That's the hockey stick. It reminds you of what risk there is. You know, last week we announced that we were going to team with New Jersey and New York in terms of a quarantine. We didn't want a lot of people flying in from those highly infected states. I think that was the right move. I was reminded looking at Chappaqua, New York, right across the border from southern Connecticut, where a young high school senior was celebrating in Florida, came back to her graduation, and before you could say it, there were 4 people infected, then more than that infected, and they had to track and trace and what stores they went into. So it just reminds you there's a very narrow margin for error, and thank goodness to date Connecticut has been on the right side of that. What else? I can tell you that also in the task force, they pointed out the number of layoffs. State and local government, 585,000 people have been laid off from state and local government across the country in the month of May alone. And that's why it's so important, as we pointed out, again, all the governors, bipartisan, red and blue states, give us some certainty in terms of what we can expect in terms of aid to states and localities, what we can expect in terms of testing, what we can expect so that Miguel knows exactly the budget he has, so that teachers know how they can get back to school safely. And one thing the Vice President pointed out was we are making some innovations in terms of testing as well. And this I'll leave you with because it's something that Connecticut has been working on since March. It's the wastewater surveillance as a leading indicator. That is, we're able to take some samples from the wastewater and test that, and you can get a broad indication of what's going on in New Haven, for example. As one of the WAGs said in the meeting today, the wastewater surveillance test has passed the smell test. And what that means is we'll be able to do that type of a testing analysis in nursing homes, universities, and we're going to roll it out to all of our municipalities. And by doing a test out of that wastewater, we'll have an indication, 5 days plus of what you can expect in terms of hospitalizations. So far, so good on that. That plus overall pooling, where they take a group of tests and put them in one and do that batch. So even though we're not doing 100,000 tests, we've done about 50,000 tests in the last week. Due to methodologies like this, we'll be able to see what the community spread is by community a lot more aggressively. And for that, we're very thankful. I think, with that, let me just open it up to questions. As I said before, Paul and Josh, and Miguel is here to answer any questions. Miguel Cordona, we rolled out formally our 50-page report on what we're doing in terms of our K-12 education reopening. It's going out to all the superintendents, it's going out to all the major stakeholders, and we look forward to their comment and as we refine this over the next few weeks. Max?
News 8.
Good afternoon, everyone. Governor, before I ask you about screening people that are entering Connecticut from hotspots, for Commissioner Cardona, if you can speak about the challenges that you face in bringing the students back, in particular, when you talk about flexibility and being open to making adjustments, on the move as everything transpires.
Thank you for the question. Definitely, we know that this plan is going to be guided mostly by our health data in the state of Connecticut, and we're working closely with the Department of Public Health to make sure that our plan is responsive to the needs of Connecticut. So we submit the plan today with the understanding that the plan is only as good as the paper it's written on, unless we're able to adjust based on what the needs are in Connecticut, and that's what we plan to do.
And Governor, with respect to screening those entering the state from hotspots?
Yeah, what we're doing as part of the quarantine plan, you remember the states that have more than a 10% positivity. We've reached out to all the airlines, we reached out to the travel agents. You maybe saw we've got the signage up, and not just Bradley, but Kennedy and LaGuardia and Newark as well. And what they're telling people is if you come in from one of those states, you must quarantine for 14 days. If you're an essential worker here for business, go get yourself a test so that you can have that piece of paper that shows that you have tested negative, and you can come up and get to work quickly. Right now, we're getting the numbers back from the airports and seeing how that has impacted traffic, and I'll be able to get back to you on that, I think, within a week. But it's really important as we look what's going on in our states around the rest of the country, not our regional states, but the states around the country, that we limit the back and forth there. And I'll tell you, Texas, by the way, had put in place a stay-at-home order. So it's not just us saying you're going to be quarantined if you come to Connecticut. It's also Governor Abbott saying we recommend Texas you stay at home.
Is there a chance those people could be screened right at the airport?
That's something we're looking at.
Channel 3 Eyewitness News.
Yeah, I'm still kind of making my way through the document that was released, but I did notice that there will be arrangements made for families to continue the online learning if they choose. But I was wondering how that might affect staffing, because I imagine a teacher will be dedicated to teaching in class. Would they be responsible for the online learning as well?
Yes, the option for families to continue with remote learning, if that's what they feel most comfortable with for their children, will be available. How that looks in districts, we'll be developing a plan for that and supporting districts. We know that there's not always one approach that's best for all communities, so we're listening to how districts consider this and work with them to try to share best practices there to mitigate not only the distance learning and making sure that students have the opportunity to learn remotely, but also balancing the responsibilities of teachers who will also have students in front of them.
And is there an outline for how sports could resume in the fall?
Yes, CAST CIAC has developed a document that they've shared that we can also reference in our plan and future editions to give parents and families an understanding of what the plans are for sports in the fall.
News 12 Connecticut.
Hello. The rental eviction moratorium has been extended, but I'm speaking to people who represent tenants who say there's not going to be enough money in the rental assistance program, and some landlords say if their banks aren't in Connecticut, they're not really getting any forbearance on their mortgage. So obviously it's a big situation. There's a lot of people who may owe several months of rent. What happens next in terms of this issue?
Yeah, we'll be rolling out our plan for the rental support. We'll be increasing the amount of money, working with landlords so landlords can work with their tenants and make sure that over a reasonable period of time, people have a chance to get back on their feet and certainly can stay in their home without worry of an eviction. We'll let you know on that tomorrow, I think it is.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. My first question was for you. When you look around the country and see what's happening, does that impact at all the schedule for the Phase 3 reopening here?
Yeah, Matt, I sure look at that very carefully. You know, as I said before, we've never opened bars, certainly not indoor, and we thought about that for phase 3. I probably would say I'm rethinking that, looking at what's going on in other parts. You know, we thought about increasing occupancy on things like restaurants. We're down at 50% for indoor. But again, Texas just lowered themselves down to 50% for indoor. So as I look what's going on in Texas and Arizona and Florida, we definitely will take that as an indicator of what we want to do in mid-July.
And my second question was for the commissioner. We heard from several unions last week who had concerns about going back full-time. They thought some type of part-time would work better in terms of class sizes. What was your response to those concerns?
Well, you know, we've been working closely with our partners, including the teachers' unions and superintendents and boards of education, to try to get the best thinking out there. And this is the first step. We're going to move forward. You know, I'm pleased to share that just last Thursday, the American Academy of Pediatrics supported in-school learning because they feel that when looking at risk factors both inside and outside of the schools, that states should consider a plan that brings students back to schools. We know there's a lot of work to be done ahead, and we're looking forward to continuing the partnership with our teachers to make sure that the plan not only is safe for students and staff to re-enter, but also one that builds confidence in the educational process moving forward.
Yeah, can I just add to that? Because that's a very good point, Miguel, you made about the American Academy of Pediatrics. It sort of reinforces a lot of the key assumptions that Miguel and his team had. You know, they emphasize, number one, anything that gets the kids back in the classroom is a plus, and do that safely. They worry about the social isolation of the kids who have been sort of more alone over the last 4 months. You know, as Miguel said, any parent or any child that doesn't feel comfortable going back into the classroom, we're going to make accommodations for them to stay at home. But the American Academy reinforced anything we do to get people safely back in the classroom ought to be a priority. They went on to say, look, how far apart necessarily your desks are is definitely secondary to A, wearing the mask, and B, cohorting, which was sort of a key parameter that you know, Miguel put into our plan as well. So I was really, you know, pleased that the American Academy sort of reinforced a lot of what we're trying to explain as we work with teachers and parents and students.
Fox 61.
Good afternoon. This question is for the commissioner. I noticed in the document that was sent out that there is a section for special needs students. We've been hearing from a lot of parents who are concerned about the special needs students going back to school, especially, you know, those kids who can't wear masks and feel uncomfortable with the PPE. What's being done to make sure that their needs are met if they do come back to the classroom?
Right. You know, students with special needs, we've heard from many parents, from folks that work with our children with special needs, and the impact of distance learning on our students with special needs is one that we take very seriously, and we want to make sure that we can provide the best opportunity for them to return to school. And we recognize that with special populations, we have to make sure that we have special accommodations, different levels of protective coverings, and different strategies to make sure that we can successfully meet their needs in the building. However, as with any other student, because special education students are regular education students first, we want to make sure that they're afforded the same choice that other students have with regard to where they receive their instruction, whether it's in school or at their home.
And another question for you, or even the governor, with all these different modifications and the learning both in the classroom and online, has there been any talk among the districts and the different school districts about hiring on more teachers? And is that something that's going to be in their budgets, which I'm sure are already stretched thin?
Sure, yes. We're asking districts to work to develop plans with input from teachers as well, to see what needs there are in their districts. And then we're asking in very short timeline to try to identify what the needs are, to see how we can use some of the funding that we have available with regard to the governor's education funds or any of the CARES funds that we have to support those districts in greatest need. We recognize that a lot of this will require some planning first, and I just want to acknowledge the work of the superintendents this afternoon moving forward to try to turn around a plan for their communities sooner than later, and then communicate that information to us so that we can communicate with to the governor and his team.
Thank you.
WTIC 1080 News.
Hi, one of your regional partners, Mr. Governor, New Jersey Governor Phil Murphy, decided not to reopen restaurant dining rooms now. Is that a bad sign of where this is going, that New Jersey is not even going back there?
Well, we opened indoors about almost 2 weeks ago, 50% capacity. So far, I think it looks like we're in a very good position. I respect what Phil did, looking at Texas and some other places, said maybe we'll hold off. I think we're in a good place right now. If you can eat outdoors, eat outdoors.
And with the raises going into effect around the state July 1st, how bad is that for the state budget, and how gloomy are things looking?
Well, it's a hit to the state budget. You know, our managers are all taking a freeze. You've seen the same thing going on at UConn. We've inherited some contractual requirements when it comes to our state employees, and we're obligated to honor that contract. Overall, our budget, we're in better position than any of our peers because of the rainy day fund, because we kept open manufacturing and a lot of other big pieces of our economy. If Congress comes back in July, which is what the Vice President anticipated, and do something on the next supplemental, as I implied before, what they're going to do for state and local aid, what they're going to do for testing, we should be in good shape, provided the economy slowly gets back to normal operating capacity by the end of this calendar year. But as you've heard me say before, if we take a second hit, if November comes around, if there's a second surge, then Connecticut and the country is really going to have to look hard at those budgets because we're going to be in a tough position. Let's not let that happen.
CT News Junkie.
Thanks, Max. Regarding the school guidance, Commissioner Cardona, define what temporary means for parents who are temporarily withdrawing their children from a school building but still want an education.
Sure. So temporary means that we will open our doors to students when their families are comfortable sending them to school. We haven't put a period of time, or they may say, I'm interested in considering it later, maybe in the beginning part of the school year. I think it's important to note, though, with this question, Christine, that, as we adjust class sizes and as we try to balance the planning of both distance learning and in-school learning, a process has to be put in place to make sure that we bring students in and make sure that class sizes are reasonable. So it's an option for parents, who are letting them know that it's not a requirement for the whole year.
And so when will the plan or the specifics of the plan for the blended learning be done?
I'm really pleased to share that tomorrow we're going to be launching Connecticut Learning Hub. This is something that a month and a half ago, 2 months ago, we didn't even have on our radar, but we knew that having content was critically important. So you'll see, as part of the plan, we have a section on academics, and the State Department of Education is going to be launching tomorrow a platform where students, families, districts can access high-quality content for students that do elect remote learning to supplement what districts might already have, free of charge to districts. So that work is underway. We're going to be launching it tomorrow. More information to come on that when we launch.
And if a student tests positive in a school, will the school be closed, and how will that be reported to parents?
Yes, there is a clear communication on what that's going to look like in our plan. We link to CDC guidelines, which have a flow chart on what it looks like. It's important that we're consistent throughout the state with how we respond to that. And in that link, it explains more specifically what communication will or will not happen in terms of how it's communicated. And as far as closures are concerned, it's really important that we follow the same protocol throughout the state. So those are guided by the recommendations in the CDC.
Hey, Christine, could I just add to that? The reason we're trying to keep these different groups self-contained, these cohorts, the 5th grade class doesn't hang out with everybody else in middle school, is in part so that we can quarantine just a particular class as opposed to the whole school if there was an infection to be found.
Thank you.
The Associated Press.
Good afternoon, Governor. Good afternoon, everyone. Commissioner, I was curious, do you know, has there, I'm sorry, I lost my question here. Has there been a survey at all regarding how many students do you think might not be returning to the classroom, and also maybe how many teachers might not be returning to the classroom? Sorry for the confusion.
That's a great question, and thank you for asking it. Yes, we have a survey ready to hit send. We're giving districts an opportunity to process the plan, and we are prepared to send information survey to districts so that they can communicate to us what the percentage of students and staff are not going to be returning. That's really important in the planning part of it, and we do have a plan in place to try to get that information as soon as possible.
Okay. And Governor, you said you hope to make some kind of decision regarding phase 3 in mid-July. What do you need to see by then to make a decision to hold off on reopening other venues or easing some of these restrictions on capacity limits?
I think I would certainly look at what's going on in those states that are on fire right now. I'd look at not only the metrics here in the state of Connecticut, but what's going on with our neighboring states as well, be that Massachusetts, New York. Just because we are part of a region, we don't just control our own destiny in that sense. So I think we usually spend 2 to 3 weeks between phases just to get a better idea. So we'll be able to make some announcements on that right after the July 4th weekend.
And have there been any issues so far with the quarantine? Have you been able to stop large groups from coming in from out of state? Just curious, maybe any details.
Well, I was talking to Bradley Airport, and they haven't been able to get me the numbers yet in terms of number of people on the flights coming in from Dallas or coming in from Miami or South Carolina. I can't figure out how they couldn't get those numbers, but we're going to get those numbers for you very soon and be able to see what impact our quarantine has had and see whether we need other protocols to make them stricter.
Thank you.
Boceto Media.
Hi, everyone. Question for the Commissioner. Next has come in the school or air circulation. According to the National Air Filtration Association, I get attached on the state various other state pending school.
All right, you got that, Miguel.
I'm sorry, I couldn't hear the question. It broke up.
We will come back around. Hearst, Connecticut Media.
Thanks, Max. Hey, could everybody mute, please? We're getting echo. Hey, Governor, how would you describe the degree of discretion local school boards have in this mandate or whatever your plan?
I think in terms of implementation, they have an awful lot of discretion. I think Miguel's been pretty clear in terms of what we're thinking about in terms of cohorting, what we're trying to do to get people back in the classroom. We're going to do this survey that he pointed out in terms of us, we get a better idea of how many kids are going to be in the classroom, how many are going to be remote learning. That'll give us an idea of what the space capacity is. But then when it comes to how you do that, every school is going to do it their own way. Is that about right, Miguel?
It is, Governor. I think, what we wanted to do is provide some guardrails that we develop with a lot of input from our partners at DPH, Department of Public Health. And those are the guardrails that are going to guide the development at the local level. We know local leaders know their communities best, local boards know their communities best, but we are asking districts to plan for fall reopening where students are in the building. We know that because, as I said earlier, the data will determine how things move. We need to be prepared for all scenarios, and we're asking districts to plan multiple scenarios.
Thanks. And Governor, you were just hinting at a possible increase in the rental assistance. The Housing Committee was meeting today talking about the state's historic segregation. And I'm wondering that in the upcoming special session, if the General Assembly decided to take away some local zoning power, would you support that in an effort to combat systemic racism?
I think it's premature to do something like that, especially in a special session, especially when you don't have broad public hearings.
Okay, and could I ask Josh a quick question?
You got it.
I'm interested. Thanks, Josh. So we're under 100 hospitalizations. It's great. Is there talk of lending some of our ventilators out to states that need it? Has that come up yet?
It's something we've talked about, and we can certainly look at if the need arises.
So at this point, you haven't heard of the need then?
Not at this time.
Thank you.
Try again with Boseto Media.
Hi, Commission has some age or state. How can the state government children ages 5?
Somebody, I'm sorry, I couldn't make out the question. Feel free to email it to me or send it to me through another form, and I'll do my best to answer it on the air during the press conference.
We'll move along next to the Hartford Current. The Hartford Current. Connecticut Public Media.
Good afternoon. Governor, you mentioned the hospitalizations. That's been kind of one of our key metrics we've been watching fall, and you said that that's something that will most likely rise because it is so low now. So what metrics should we be watching to see if there are going to be any changes to, indoor dining, gyms being closed? Is there a hard number you guys have, an infection rate that might close some of the things that are open now?
Yeah, hospitalization is important, especially when it comes to hospital capacity, ICU and hospital beds in general, to make sure we have capacity there if, God forbid, there was an Arizona-like surge here. And as you point out, the positivity rate is so important right now. It's not simply a matter of how many tests you've done, but the percentage of people who test positive. That tells us a lot about community spread more broadly in the community.
Move along next to the Hartford Current.
Hi, thanks. Some technical difficulties. Governor, you'd mentioned last week that you were considering creating testing sites at transportation hubs like Bradley. What's the status of that plan?
Well, we're talking to some of the airlines tomorrow to see what their appetite is. It's a little complicated in terms of who does it, how it gets paid for, et cetera, but it does make a certain amount of sense. I know how, Maine, you bring a certificate that shows you've tested negative, but let me again say, let me get back to you on that.
Thank you.
The Connecticut Mirror.
Governor, I just want to clarify something. When you talk about phase 3, are you saying that even if Connecticut's metrics meet your standards, based on a careful approach, other states may dictate a delay?
I don't know about dictate, Paz, but Obviously, if I saw something in Massachusetts or New York that was very disturbing, it would certainly give me pause. And when I see in Arizona, Texas, and Florida, it shows you that things can change very quickly.
Okay, but it's not just Connecticut metrics that will inform your decision. Is that fair?
I think that's fair, but look, overwhelmingly, our state tends to walk in parallel with some of our neighbors, so I think you'll find them aligned.
Okay, a question for the commissioner, I guess to you as well, Governor. When you talk about the importance of having these grades as standalone cohorts, are you saying that if one kid tests positive, that you're not going to have to order a 14-day quarantine of an entire class?
The CDC guidelines provide very clear direction with regard to how things are handled. And it's also very highly recommended in CDC that these decisions are made with local health department input. Every situation is a little bit different. Every case is a little bit different. So while there's consistency in what's expected, depending on whether there are siblings or what type of contact the student has had, it could change whether it's a classroom or a larger group of students that are quarantined or sent home. And it usually recommends the closure a short period of time for this information to be gathered in the school. So the CDC guidelines, which are linked on our plan, provide much more information.
Thank you.
I have two questions from Boceto Media. We'll start with the first one for Commissioner Cardona. Connecticut has some aging school buildings with poor circulation. Knowing that, how can the state guarantee parents the safety of their children of this highly contagious virus?
That's a great question, and one that we have been talking about, and one we've been discussing not only here at the agency and looking at CDC guidance on that, but also partnering with our OPM, which also handles the building construction projects and school buildings. So we have information for those districts on ventilation systems and strategies to make sure that fresh air is circulating through, and that is included in our guidance. But we're also making available to all districts the consultation of Casas Diamantes, who is the person at the state level that has a really good understanding of facilities and how to maximize airflow in facilities.
And the next question, will temperatures be taken prior to entering the school bus and school buildings? Will there be a bus driver assistant to help control the spread?
We're recommending that in cases where students are not able to keep where there are a lot of young children on the bus, or there are buses that have high capacity, we're recommending that districts consider placing monitors, especially to get students acclimated into the process of where to sit, assigned seating. And while we're not requiring temperature checks, districts may choose to do that, and we are asking, and there's a section in our plan that discusses or that communicates the expectation of parents to do checks regularly before sending their children to school. At the end of the day, that's going to be the best measure. If your child is sick or showing symptoms, keep your child home and be prepared to keep your child home for multiple days if that's the case.
The Waterbury Republican American.
Thank you, Max. Governor, quick question on the travel advisory ban. Where do things stand with your talks on an exemption for folks that can document that they have tested negative prior, I believe you've been referring to a 72-hour period, and if there is no agreement with New York and New Jersey, would you consider taking unilateral action here in Connecticut?
Yeah, let me get back to you on that. It makes a certain amount of sense for me, especially those essential workers who are already sort of exempt from the quarantine because they got to come up for business in, military or something. We're trying to work on that together with the 3 states, but it definitely makes sense to me, Paul.
And a reader question for you also. How long will the recommendation stand for older or immune-challenged workers and individuals to work from home and stay at home and reduce their travel to the minimum necessary?
Look, I think immune-challenged, older folks, I think we're going to still maintain a strong recommendation that you stay close to home. We're seeing around the country, while their younger people are showing infections and being able to infect others, still you know where the period of the greatest risk is. So I don't see that changing for the near term.
Okay, in terms of the school reopening plan, the plan refers to recommendations and requirements. How will the requirements be enforced? How will the state make sure that school districts are complying? Is this going to be sort of an honor system, or is there actually going to be inspections and paperwork being filed?
We are going to be receiving the plans from the districts, but quite frankly, districts have a board and they have a leadership structure there, and their goals are the same as ours, to ensure health and safety to all the students and staff. And we anticipate that while we are sharing and communicating best practices and being very clear about what the expectations are, the plans that they have available, we're asking that they also be shared online so that all families have it. We're also asking districts to identify a person as a liaison that can serve to hear any concerns of compliance that might be lodged with families or even staff members that see something that they don't feel follows the process that was outlined. And I think that's a more authentic way to assess whether or not districts are following the plans. At the end of the day, we're all in this together, and we have to make sure that we're all vigilant and we're all following the plan that is established.
And what are the, I was trying to find some sort of recommendations and guidance regarding teachers who are older and have concerns about potential exposure. I'm not quite sure I saw anything in it, but I will admit that I've just been kind of reading through it as we go here. So. Yeah,
it was just released a couple hours ago, so you gotta pass there. Yes, there is some guidance in there. We want to give districts the opportunity to accommodate as best you can for folks that are in our districts that may have comorbidities or may have higher risk factors. But we're recognizing also that might not be possible for all. So we're going to engage with our teachers to try to, and our district leaders to try to find possible solutions to this. This is a challenge that we recognize. It may be that some teachers can focus on the remote learning part of it, or can assist in ways that limits contact. But we know that to reopen schools, we're going to have to look at a lot of things that they're not quick answers, and that's one of them. We're committed to working with our teachers and our districts to make sure we find the best possible outcome for our learners.
Thank you.
All right, let me conclude by reminding everybody what I heard from every governor today. Wearing the mask is more important than ever. Thankfully, Connecticut has been a leader when it comes to wearing the mask. So Max and I have created a little contest around the state to see who can come up with the best statement about the importance of wearing the mask. And today we'll give you two of our contestants. The first, posthumously, is Freddie Mercury. Many of you remember him from Queen, at least those of a certain age. No mask on your face, your big disgrace, spreading your germs all over the place. We will not sing that song, but that's Freddie Mercury's submission. And Max, the other submission is by Gino Auriemma, the great coach of the UConn women's basketball team. Take it from there, Gino.
People ask me all the time, Gino, do I have to wear a mask? Yeah, you got to wear a mask. They say defense wins championships, but it's more than that. It's about being together. It's about being unselfish. It's about being a great teammate. So do the right thing, and you might get 11 national championships. You probably won't, but wear a mask.
All right, you're great, Freddie, but Gino, I think you nailed it. Thank you, everybody.